Did you know that different areas of what's hurting in your knee can give us some diagnostic insight on what's going on? Let's get right into it. We're going to start with the location above the kneecap. So two main things can be happening here. We can be talking about quadriceps tendinopathy, or we could be talking about swelling in the superior recess of the knee here. And there's a way to tell the difference. So this is the area we're talking about. It's right above the kneecap, above that last hard part that you can feel towards your quadricep muscles. Typically, with swelling in the superior recess, you'll have a feeling of fullness, but not necessarily a feeling of pain when you go into knee flexion. Versus quadriceps tendinopathy, especially if it's new, you're going to have a fair amount of pain when you bend your knee fully. If you do have that feeling of fullness above your patella, that might be indicative of an old knee injury that's actually pushing swelling there, and we're going to go over some of those later. Best option for both of these is rehabilitation exercises, ideally exercises that focus on strength in the leg and in the hip region. The second area is pain underneath the kneecap. When I say pain under the kneecap, here's the kneecap here. I'm talking about pain not below the kneecap, but actually on the underside itself. Usually when this is happening, we're talking about runner's knee or patellofemoral pain syndrome, which is often abbreviated PFPS. Runner's knee or PFPS usually feels like pain on the underside of your kneecap, usually on the lateral or the outside aspect of the kneecap, and can sometimes come with some clicking or popping that may be painful. This usually hurts most when you're running, hence runner's knee, and especially if you're running downhill. For more on runner's knee specifically, we have a whole video going over the anatomy and aspects of this in the description below, or you can reach out to us for telehealth. Other conditions that can produce pain behind the kneecap can include degenerative arthritis or chondromalacia patella. Chondromalacia patella basically means that the cartilage on the underside of your kneecap is frayed or damaged, and suddenly it's producing clicking and friction between the kneecap and the femur behind it. Both of these conditions, degenerative arthritis and chondromalacia patella, are usually folks who are over 40 who have a history of lots of lower leg activity. Now, runner's knee and degenerative arthritis and chondromalacia patella are all behind the kneecap pain conditions, but to tell the difference, you really need a full physical exam, or you can point slightly towards age-related changes, which is more in the arthritis or the chondromalacia bucket. Typically, for most cases, not everybody needs surgery for this unless you're finding that you have really limited range of motion, like you can't bend and extend your knee very much at all. Rehab, again, helps the majority of these cases, and especially the case for runner's knee or PFPS. Pain over the knee, especially right on top of the kneecap, usually looks like kind of half a golf ball was stuck on your kneecap. We're usually talking about prepatellar bursitis. Bursitis means swelling of the fluid-filled sac that's in the area indicated, and usually this is treated with aspiration. So they take a needle and they pull some of the fluid out of there. Prepatellar bursitis is usually caused by excessive contact. So if you find yourself kneeling on that kneecap over and over, that might be a cause. It's usually called nursemaid's knee for this reason, because they're often kneeling to help treat patients. Next, we're going to move on to below the kneecap, where you can feel that tendon. That is your patellar tendon. And usually the pain here is under patellar tendinopathy. Now, tendinopathy is an umbrella term that can include tendinitis, but tendinitis is an inflammatory condition. So if you've had this for like 10 months, it's probably not tendinitis. It would be tendinopathy. Patellar tendinopathy is also often called jumper's knee, because when you get pain right under the kneecap, and we're talking pretty pinpoint here, small area, this can commonly be caused by excessive jumping or introduction of plyometrics into your program. For patellar tendinopathy, we're talking about, again, that tendon right under the kneecap that inserts into your shin bone here, and the pain is usually fairly broad. Sometimes you can even get creaking with this, but if it's pinpoint pain just at the tip of your kneecap at the bottom, that might be jumper's knee, which only is in a local area there. Treatment for both of these usually involves heavy isometric exercises, and by isometric, we mean same length of the muscle exercises. So this is not flexing and bending your knees. Instead, it's putting your knee in a certain position under tension and contracting against it. When we have pain on the lateral aspect below the kneecap, so this is somewhere in between your fibula and your kneecap on the outside here, we may be talking about Hoffa's fat pad syndrome. Hoffa's fat pad syndrome is often tied with patellofemoral pain syndrome, and it can feel like a dull, achy pain, again, on the outside part of your kneecap when you're starting to go towards your fibula here. This usually hurts most with terminal extension of the knee, so when it goes straight out and you contract to try and hyperextend it, that's usually where it hurts more, and it can feel like dull or sharp pain, but the longer it goes on, usually it's more and more dull. Similar to treatment for patellofemoral pain syndrome, the best thing is to offload the area using strengthening exercises for the leg and for the hip. Next, we're going to go to the inner side of the knee, right along the joint line of the knee here. And pain here is usually indicative of medial meniscus injury. Usually with a meniscus injury here, you're going to have clicking, popping, and potentially locking of the knee, and it feels unstable when you do twisting motions. Typically with medial meniscus injuries too, you won't be able to get into full knee flexion, so you won't be able to sit on your feet here, and you may find that when you're sleeping at night and your foot gets caught in the sheets, that it's going to be painful and hard to get out of the sheets. You may have seen information about surgery for meniscus injuries, and that's usually indicated when you have a bucket handle tear that goes along the meniscus itself, and you'll know if you have it by either imaging or your knee is locked into place and really can't move at all. In those cases, surgery is typically the best option, and in all other cases, you want to do rehab instead. Next, we're going to move below the joint line into the inside bottom part of the knee. Now, as we move to the outside middle of the knee, you actually want to move lower than you would think. So you'll feel your knee, and when it starts to drop off towards your shin bone, this is where the pes anserinus is. And usually the issue here is pes anserinus bursitis. You'll be able to see if it's pes anserinus bursitis if it's actually visibly swollen. If it's not and you have pain here, this may be a sign that the infrapatellar nerve is irritated, which goes to that exact same area. Usually these conditions hurt when you've been sitting for a while and you stand up, and also when you're walking upstairs. If we're talking about pes anserinus bursitis, this is an overuse injury of the muscles that attach in that area. So logic goes that if you were using this too much, we need to move that load to somewhere else. So again, this is where hip exercises in your rehab can really help. If we're talking about the nerve that goes in this area, you can be taught actual manual techniques to help calm down that nerve, or go to somebody who knows how to evaluate nerve injuries and get the treatment from there. Next, my personal favorite, because I've experienced this, we're going to be talking about IT band syndrome, which is on the outside of the knee. Now, it may feel like clicking, especially painful clicking on the outside of the knee when you're trying to flex and extend it. Runners, this is a really common injury for us, but it can also be confused for a nerve root irritation in the area. So we're talking about L5, that's your fifth lumbar vertebra. The nerve root that comes from there can refer down the side of the leg into that same exact area where the IT band inserts into the tubercle. They can feel very similar, but you can tell the difference based on that popping and clicking. That's usually IT band syndrome, versus just pain, especially if it radiates up the side of the leg. You may be wanting to look at that nerve instead. Rehab for this is absolutely crucial, especially for us runners who use our legs so much. For the nerve condition, it's crucial to figure out where that's coming from, if it's the spine or local, and calm it down from there. And for IT band syndrome itself, it's really about controlling the friction in the area, which again, rehab exercises that offload the area can really help. Now moving to the outside of the knee, but in the joint line itself, especially if you're older, we're talking about osteoarthritis. So that's arthritis in the bones itself. This usually presents as a dull aching pain, and you may have issues with bending your knee, sometimes with extension as well, but you will have pain for a long time before you get a formal diagnosis of this. So those of you who have had pain in this area for over a decade, you might be more in this category. Pinching in the back of the knee, or the knee pit, is usually indicative of either a Baker's cyst, which you can actually see, it's like a swelling, usually the size of a golf ball, right in the knee pit there, or an injury in the meniscus. And usually you're going to feel a lot of fullness and potentially pain when you sit on your heels like this, getting into full knee flexion. Treatment for this, we covered the meniscus treatment prior to this, rewind if you don't remember. And for the Baker's cyst itself, you're usually going to need to aspirate it, similar to a bursitis, where they take a needle, they stick it in there, and they actually drain the fluid out of it. Now lastly, we won't go over this in detail, but ACL injuries are also quite common. You'll feel a pop and know immediately that you injured your knee. Typically, the swelling comes on quite quickly, and you usually, if it's a full rupture, will need surgical management. That being said, a lot of these knee conditions that we went over in this video can be secondary to old ACL injuries or reconstructions. The runner's knee video should be somewhere on the screen right now. Check it out, and we have telehealth options if you ever need any advice.